Thank you, Mr. President. I rise to explain my vote. No, I would be remiss in this moment, again, if I didn't join in the sentiments that have been shared thus far in expressing my gratitude and appreciation to Senate Majority Leader Andrea Stewart-Cousins for advancing this very comprehensive and important first step, or continuation of steps rather, in addressing reproductive and maternal health outcomes here in New York. And so this legislation seeks to provide information to increase transparency as it relates to the racial disparities of pregnancy and birth outcomes by expanding upon an existing law that is aimed at presenting important information to prospective mothers. Prior to serving in the Senate, I had the opportunity to serve on a statewide task force that looked at racial and ethnic disparities in healthcare, and to no surprise by many of us, but still a call to action, there are still significant health disparities as it pertains to race and also socioeconomic status when it comes to these issues. And yet we have an opportunity to do something about it, and also an obligation. And with this legislation, it lifts up this evidence about how expectant mothers and birthing people in BIPOC and rural communities are often presented with limited options for prenatal care and childbirth. And we need to provide information to expectant mothers that will help them to make an informed decisions. Statistics have demonstrated that Black women are at least 3 times more likely to die from pregnancy and birth-related complications, and are 50% more likely to suffer severe pregnancy and birth complications. This doesn't happen just out of nowhere. There are policies and practices that institute this, and so this legislation will empower women with the information they need to make informed decisions about their care and the care of their infants. Current law requires hospitals and birth centers to distribute informational leaflets that include information on statistics related to maternal procedures performed at the hospital or birth center to maternity patients before they are admitted. The information must include birth-related events and procedures such as vaginal or cesarean births, use of forceps or vacuum, inductions, vaginal births after prior cesareans, and other vital statistics. This legislation would expand the information about the facility so that way patients are making more informed decisions. And again, I want to thank the Majority Leader and all of my colleagues today for the legislation that they have advanced, and I proudly vote aye, and I encourage my colleagues to do the same. Thank you.